AIDS, pregnancy, sex.
Sex? Did you say sex?
As prescribed, take your medication, exercise, and diet. On 88.5 Sufra FM, tell a friend, call your neighbor. Casualty 911 is on.
Good morning, everybody, and welcome to a new edition of Casualty 911 on 88.5 Super FM. I am your host today, Fawn Minviel, health educator with the Ministry of Health. Louisa was with you last week. I'm sure you got some wonderful information from Louisa. This morning, we will be joined by a guest who will be delving into cervical cancer awareness, as we mentioned on the first episode of Casualty 911 this month. This month is observed as Cervical Cancer Awareness Month, and so we will be delving into this topic today with our guest, Dr. Paulcus Lendor. Doc, I'm jumping right in. Welcome.
Thank you very much. Good morning
Good
to
morning.
all. Yes.
Okay, good morning. And good morning to all of our listeners as well. Thank you for tuning in to Casualty 911 this morning. For those of you joining us for the first time, we hope that you will find this program very informative and you will be motivated to join us again every Monday from 10 a.m. to 11 a.m. So, Dr. Lendor, thank you so much for joining us this morning. It is a pleasure to have you on the program.
That pleasure is mine for joining you all. I hope I can provide information in a manner that is easy for your audience to understand and for them to remember in the future.
I'm sure you'll do an excellent job. So today we will be talking about cervical cancer. What is cervical cancer? Who can get cervical cancer? Our screening protocols. And as some of you may be aware, we have the UHC screening. We have cervical cancer under the UHC program. So we will be talking about the various services available and the procedures in terms of referrals and so on, what has been happening since the implementation last year. And we will be really trying to figure out where we stand as a country as it relates to cervical cancer. And one of the things is that the WHO spoke about elimination of cervical cancer, which is something that we don't really, you don't generally hear people talk about eliminating cancer. So all of those things we will be talking about today with Dr. Lendor, and I'm sure you will get a lot of information. So let us start off, Doc. I'm sure
Yes.
you have a long history of working in St. Lucia. I'm sure you have many clients. You have interacted with a lot of people, but I would still appreciate it if you would give us a brief intro. Tell us a little bit about your background and your work in the medical field.
Okay, well, I started medicine in St. Lucia in 1992. I am a Cuban trained professional. I left St. Lucia again in 1996 to do a 4 year course in specialization, again in Cuba, and returned to St. Lucia in the year 2000. Since then, I have worked at a number of institutions, um, St. Jude Hospital, Victoria Hospital, Grocery Polyclinic as a community OBGYN. I have worked as a community OBGYN, the Demi Hospital, the Sufre Hospital, and presently I am assisting the Ministry of Health in upscaling the cervical cancer screening program by taking on the responsibility in reorganizing the whole manner in which our program is run and doing the necessary evaluation and management of all those cases that come with abnormal results.
Wonderful. So you've worked in Sufre, so I'm sure our listeners in Sufre are very familiar with the face and the voice.
I came to Sufre in, I think, in 2002 after an unfortunate death we had at Mont LeBlanc, I think, maternal death we had. And I started doing a twice a month program that was suspended for some reason. And again, we started over in August, I think, of last year with a special clinic in Sufred that's done on the first Friday of every month. It is called a colposcopy clinic.
And we'll be talking a little bit
We
more
will
about
be
that
talking
later
about
on.
that as we proceed in our program.
Yes.
Um, in I engaged the Ministry of Health in 2019, the end of 2019 into 2020. But in March of 2020, sorry, we started with that COVID epidemic, and it threw everything off balance. Um, at that time, I was not familiar with the World Health Organization agenda to eliminate cervical cancer. But since I recognized that we had the means of doing that, I engaged the Ministry of Health in that aspect. It found itself on pause because of the COVID pandemic. And after the pandemic, I re engaged the Ministry of Health so that we could move ahead with our program. In August of 2024, we were able to make that transformation in our screening and management program, and a lot of focus in that presentation today would be looking at those changes that were made as of August 2024 and its impact and results to date.
Absolutely. Okay. So let us first start off by just giving some brief information about what is cervical cancer and who can be affected by cervical cancer. Then we'll talk a bit about elimination and what
Yes,
is being said under the WHO agenda as it relates to
yes.
elimination.
Cancer of the cervix is a condition that quite a number of individuals in St. Lucia have suffered from. In the early stages, when the conventional pap smear, that is what everybody knows as the pap smear, was being done, our aim was to identify abnormal cells at a stage early enough to prevent those abnormal cells from developing quickly and in an abnormal way, and at the same time causing an entire invasion into your body and spread as cancer. Cancer cells, really and truly, are cells that take an abnormal developmental pattern and they what we call proliferate, they multiply at a very quick rate, um, exploiting all reserves of the body, protein, glucose, um, our own energy to provide repair for our body. So it exploits everything and it starts to develop in an abnormal manner, and it takes full control of your body's system to allow itself to grow and develop in an abnormal manner. And as it relates to cancer of the cervix, the focus starts, the injury starts in the cervix. It starts to, the abnormal cell starts to develop initially in a slow manner, and then as the abnormality progresses, it starts to develop at a faster rate. Um, it is localized initially to the cervix, but then it spreads from the cervix to all the organs that are close by, and then spreads from those organs that are close by to your lungs, your liver, your brain that are further away, depending on what stage of the cancer that you have. In the initial stages, when that cancer was being investigated, a number of factors were associated with that abnormality. And sex was a principal factor that was associated with that cancer. Um, it was recognized that individuals who never had sex did not develop that cancer. We also recognized that men who were in a prior relationship with a woman who had cancer was also spreading that to the new partner, and the new partner had a chance of, or a high chance of also developing and dying from that cancer. So it was called what we call the male factor. So a number of risk factors were identified, and the male factor, meaning that there was something about men that was causing that cancer to spread to women. Um, we initially thought that there were genetic factors associated, but as research progressed, a microorganism was identified called the human papillomavirus as the principal cause of the problem. And as investigations proceeded, we now have a better understanding of that cancer, what causes it, what can be done to prevent it from happening, and because of that, we have decided to readjust our screening program to take those factors into consideration, and a number of adjustments has been made to our cancer screening program. Initially, we used to do what we call the pap smear, where a speculum was introduced into the vagina. We took a look at the cervix and used a spatula. Most people would know it's like a wooden spoon. We would pass it on the cervix and then pass it on a glass slide. Spray it with a fixatives so that the cells can remain as stable as possible, and then send it to the lab for them to take a look at what is happening. Presently, we no longer use that method. We are using now a liquid base where we use uh, an instrument in the shape of a broom, like a plastic broom. It's called a broom. The cervix with specimen, put it in a container with a fluid, and then send it to the lab so that it can be processed. With the old method, sometimes the specimen was not collected adequately. Also, there were restrictions in what could have been done with that specimen. But with this new method that we are using, what we do is like it cleans off all impurities and allow you to just look at the cells on your slide. And it also allows us to do a test for the human papillomavirus, which is the virus responsible for causing cancer of the cervix. This virus falls into two broad categories. We have low risk HPV, which are associated with causing genital warts and some degree of abnormality on the cells of the cervix, but it does not progress into cancer. On the other hand, there's another group called the high risk HPV. These are the ones, and there are 13 of them. These are the ones that are responsible for causing cancer of the cervix. So when we screen and you get your results, the screening tests for HPV would be to determine whether there are any of those high risk HPV. So if your results see your HPV is negative, it doesn't mean to say you have not been in contact with the HPV virus. It means that the high risk HPV was not detected in your specimen. And when we have those results, we can safely say that your chances of developing cancer or any serious abnormal cells in the next 5 years is very high. So we move your screening from doing it every year or every 3 years, as was done in the most recent of time, to every 5 years. On the other hand, if your results indicate that you have had, sorry, that you are HPV high risk positive, that is the ones that are causing cancer, you're positive for any of them, then we put you in another category because that means you have a chance of progressing into and developing cervical cancer if your body is unable to clear that virus adequately. There are two of those viruses that are very aggressive, the HPV 16 and the HPV 18. Anytime we identify individuals with 16 or 18 with an presence in your specimen, we do a special test for you called a colposcopy. Sorry, a colposcopy. That I will explain a little later as we proceed. On the other hand, if your HPV high risk is positive and it is neither 16 or 18, then we do a test to look at what degree of abnormality exists in the cells that are collected. The results may be HPV high risk positive and normal cells. It can also be HPV positive and low grade abnormalities, or it can be HPV positive with high grade abnormalities. Individuals who have a result with a low grade abnormality or HPV, sorry, or the cells are normal, we normally monitor them for a period of about 2 years to allow their body time clear the virus, because as long as the virus is there, you have the risk of developing cancer of the cervix. But we don't just let the individual go for a period of about 2 years. What we do, 1 year after the test was done, we repeat it to see whether the HPV has been cleared. If the HPV has been cleared, then we repeat your test again in the next 3 to 5 years. On the other hand, if the HPV remains positive and it continues as a low grade abnormality, then we give you the second year of monitoring to see whether your body has the capacity to clear that virus. As long as your body clears the virus, your body is able to repair the abnormal cells and eliminate your risk for developing cancer of the cervix. On the other hand, if the results indicate that you have a high grade abnormality, it means your body has failed to do the necessary repairs to clear the virus, and that virus is continuing to cause more and more severe abnormality. Then we will have to evaluate you through a procedure called colposcopy to determine one, the extent of the abnormality, and secondly, based on the extent of that abnormality, what treatment options we shall be using to deal with those abnormal cells. In reference with the abnormal cells that are caused by the virus, we need to understand that the longer the virus remains in your body, the less your body is able to clear that virus, is the more damage it is going to cause. This is a very slow process, and it usually takes a period between 7 to 10 years to start from a low grade abnormality to progress to cancer. Hence, we have sufficient time to identify it early enough, and we have the instruments available to detect it and treat it adequately. Now, we are not very good at protecting ourselves against the HPV virus. This is a virus that is widespread in our environment. About 80% of our population that have had sex at one stage or another have been in contact with that virus. And some of us are passing it from one individual to another without being aware that this is happening. And when your body immune system is not efficient enough to clear that virus, it stays for a prolonged period of time in your body and causes the abnormality. There are measures to deal with the virus. And in 2007, a number of vaccines were introduced to help boost our immune system to protect us against that virus. In the initial stage, the vaccine was only given to children who had never had sex before. Now it has been expanded In 2019, it was expanded to individuals who were 26 years, and from 2021, it has been expanded to individuals who are 46 years and under. There are a number of variants of that vaccine. Um, we have Cervical, which is a British vaccine, well, a European vaccine, and the one that is used in St. Lucia is an American vaccine called Gardasil. In St. Lucia, in the public setting, this vaccine was introduced in 2018, and it is only being given to students who are going to do the common entrance. This is because this vaccine is very expensive, and the state does not have the resources presently to invest in providing a wider coverage for that vaccine. Now, many times you hear the World Health Organization pushing agendas and to getting vaccines and things of that sort. But sometimes the restrictions on states like ours they consider to be um, developing developing states with a high per capita income. They create restrictions that makes access a little more difficult for us. Hence, sometimes we are not able to capitalize efficiently on those programs to make maximum use of it. What we are doing in Seneca is when we identify individuals with abnormal cells or the HPV positive, we, rec- we interpret it as the immune system is not efficient enough to clear that virus quickly enough, so it is able to cause those abnormal cells. So the extra vaccines that we have for that were not used for the students during their common entrance, we use it for those individuals while those vaccines are available. When the supply is depleted, then we have to resort to getting it in the private sector, and these vaccines are costly. Each vaccine in the private sector will cost about $800. So it's a bit expensive, although it's important, but a bit expensive for many of our citizens.
So, Dr. Lendor, let me just interject here a little. You know, this you spoke about the vaccine being offered to students, and of late, there seems to be quite a reluctance on the part of both parents and the students who are involved in their own health and so on in terms of receiving the vaccine in grade 6. What would you say to parents or to the students? Because some of them are very deeply involved in making the decision in terms of receiving the vaccine. I, I I would think that one of the reasons that they are reluctant is that they anticipate a certain level of harm to them. So, what would you say to parents and students in that situation?
There are two main reasons why we have a resistance by parents for their students to accept vaccines. Before the COVID pandemic, there was the argument that giving the students the vaccine would somewhat be indirectly giving them permission to start having sexual intercourse, which in itself is an error because whether or not the student received a vaccine, if for reasons of the environment they are bringing their home and peer influence would have pushed them to having early sexual intercourse, taking the vaccine would not enhance that. And those who are disciplined enough to be to listen to their parents and be responsible with their behavior, whether they received the vaccine, they would have continued along that path. During and after the COVID pandemic, there was that widespread discourse over the vaccines. And there has been generalization, although the argument was the technology involved in creating those COVID vaccines were new advances in technology, and we were not very familiar with the impact of such technology. Um, so there was that hesitancy initially, and then became the generalization of vaccines causing certain illnesses and certain problems, which was not founded in any substantial investigation. But the information was circulated and disseminated widely, so it created that fear. The uptake of vaccine, the HPV vaccine, had gone down um, during the immediate post-COVID era. But we have recognized now that our uptake is a little over 80%, and what the World Health Organization is looking for is a 90% coverage in girls, but we give it to both boys and girls. And the uptick right now seems to be growing towards that 90% coverage. I encourage individuals who have the access and the opportunity to take the vaccine to take it because one, the HPV virus is very widespread in our environment. It is highly contagious and it is responsible for causing a number of cancers, all related to sexual intercourse. It gives you, and then our behavior during sex places us at a great risk of getting exposed to that virus because of its widespread coverage and our inability to defend ourselves efficiently against it. The cancers it can cause are as follows. It can cause cancer of the tongue, cancer of the throat, cancer of the mouth, cancer of the neck, cancer of the anus, cancer of the vulva, that's on the outside, cancer of the vagina, that's the inside, and the cervix, which is the neck of the womb. It also causes cancer of the anus and cancer of the penis. Now, if you look at all those cancers, they are intricately associated with sexual intercourse. And culturally, we have certain sexual behaviors that places us, both men and women, at a very high risk of developing those cancers because number one, we do not know who has it. Number two, when it comes to sex, we take excessive risk. And number three, the only way we can do early screening and testing is through checking the woman's cervix. For all the other cancers, we do not have any early screening measure. So, because of that, I recommend that both men and women take that vaccine to protect themselves against the virus. The technology that is used to produce those vaccines is the very same one that existed long before the modern methods that we have now, which is taking a small fragment from that virus that is not capable of causing an infection, inoculating the individual, and causing an immunological response. We are not making any genetic modification in the virus as with the newer vaccines. So the fear as it related to vaccines similar to that of the of COVID is minimum. And considering that our behavior when it comes to sex has a high level of irresponsibility, and we cannot deny it. Hence, there is that need to increase access and coverage with that vaccine to better protect our population. Because, really and truly, we do not have the necessary systems and resources to manage cancers adequately. We do not have chemotherapy is very expensive. To do radiation, you have to go out. Thousands and thousands of dollars are invested in those treatment modalities, and the results are all not always satisfactory. So, if we are able to intervene at a much earlier stage where we boost our immune system with the vaccines, we do the early detection through screening and management of those abnormal cells, then we are in a better position. And this is where the World Health Organization is pushing the agenda of eliminating cervical cancer. So, if a sufficient number of our individuals are adequately vaccinated against that virus, the amount of that virus that is circulating in our environment will reduce, will gradually reduce, and make it less risky to get in contact with that microorganism called the human papillomavirus.
Now, you have mentioned the HPV quite a number of times, and you said that it's widespread. Usually, when we speak about viruses, people expect to have certain symptoms to know that they have been infected by something. Is that what obtains? Is that what really
Not
happens
at
with the
all. Not
HPV?
at
Can you
all.
know
Not at
that
all.
you have it?
No, you wouldn't know. That's why I said earlier on the only way we would know that you have it is through our screening program for cancer of the cervix. The thing about the HPV virus is that it works in a very slow and insidious manner. It shows no symptoms. It's there at a very low level that it escapes getting in contact with your blood system, and hence your body is unable to provide the adequate immunological response against that virus. So about 80% of us are carrying more or more of us are carrying that virus around, and we're not even aware of it. By the time you start feeling symptoms, it's because it is already too late. So you do not want to get to that stage at all, because it means you have established that cancer has been established, and it has gone beyond where simple treatment is required.
Okay. So, based on what you said, that really highlights the importance of screening. So UHC has the cervical cancer screening program available. The services are available at all the wellness centers island-wide. Since it has been implemented, the PAP test, where the HPV testing is done, since its implementation, since they started doing it, what have you noticed in terms
Okay.
of uptake of people coming in to get their
Okay.
screening done?
Um, One of the problems that we face in our system is that um, before the program, data was not, data was being collected, but it was not being collected in a manner that would have allowed, I wouldn't say data, information it was being collected, but it was not being processed as data to allow us to make the necessary interpretation and comparison.
Okay.
What I can tell you is that about 20% of individuals who are screened will show some degree of abnormality. And in that 20%, about 10% would require an active intervention. And when I say active intervention, I'm talking about individuals with a high grade abnormality or individuals with HPV 16 and 18, where irrespective of the degree of abnormality, we have to intervene. How do we intervene? We intervene through our clinic. We have a number of clinics, although the screening is done at all our wellness center, but the evaluation of those abnormal results are done at specific points. Presently, it is being done at the Grocery Polyclinic, the Ancillary Wellness Center, Soufre Hospital, and the Viewfort Wellness Center. There are plans to expand the service to the Denry Hospital and the Becky Wells Wellness Center. So there are two other institutions where those services will be made available. It entails special instruments which has a special light and magnification that allows us to take a look at the cervix. It amplifies it. We add a little vinegar that allows us to determine normal tissue from abnormal tissue. Anywhere we find abnormal tissue, we use special instruments to take a piece to do a biopsy, send it to the lab, and it tells us what is going on. About 10% of our population that is screened would require that test. For now, I think we have screened about 4,500 or so um, women with four in that program, the new method that we are using. And we have been able to about five individuals with early stage cancer have been detected, and they have received treatment, adequate treatment, and we know that the chances of developing cervical cancer has been reduced or eliminated for now, and we need to continue monitoring them to make sure they do not get back in contact with the human papilloma virus, and if so, be able to detect the abnormal cells that it causes early enough so that it does not get to such an advanced stage. Um, Individuals with high grade abnormalities and early cancers, they go through a surgical procedure. Um, when it has not extended into early cancer, we do a procedure called a LEAP, which is loop electroexcision, where we use a loop with an electrical current passing through it, and we simply just cut off the abnormal area. Then this is done in an office setting. The individual just gets up, walk away, and we follow them up for the next 25 years. Those with more advanced injuries, like carcinoma in situ, that means the cancer is in the cervix, but it has not spread outside of a certain limit. Or it has not broken through the membrane and penetrated to start spreading. We do what you call a conization, where in the form of a cone, we take them into the operating room. In the form of a cone, we take out that abnormal tissue and follow them up subsequently for that same period of about 25 years, monitoring the type of cells that are being produced on the cervix and the presence or not of the HPV virus. And that is where the vaccine plays such an important role, because if your body can combat that virus efficiently, to eliminate it fast enough that it does not cause abnormal cells, then your chances of developing cancer of the cervix becomes zero. And if it becomes zero for an extensive part of the population, then we are in the position to eliminate cervical cancer. And that's how we intend to eliminate it. So, vaccination, early screening through liquid based cytology to do HPV and check for abnormal cells, those with abnormal HPV and abnormal cells be monitored and evaluated at our colposcopy clinics and treated in a timely manner so that we can eliminate those abnormal cells and prevent it from progressing into cancer.
So you mentioned earlier that it's initially the development, the changes in the cell progress very slowly.
Yeah.
And one of the things I hear quite often from women out in the community is that they have not had a a pap test, they have not gone for any screening for a long period of time. And very often it is linked with the experience that they had at the time. So if their last screening was a bad experience, they tend not to return. So, what would you say to those people who are reluctant to come in to get the screening because it is available and it is easily accessible to all women in St. Lucia?
The vast majority of individuals who do not come to the pap smear is because of the fear of knowing. And I say to them, your fear of not knowing disappears after you know you have it. So it makes no sense. So it's best you know while something can be done than to wait for it to be too late, where your fear now is not of what you of knowing, but being able to get a cure. And most times at that stage, you do not have the resources, we do not have the resources to cure the problem that you have. A few individuals may have had negative experiences. Now, the negative experience is usually due to one, the individual's apprehensiveness to getting the test done. They contract the muscles on the perineum, and the care provider not taking that into consideration, instead of waiting for adequate relaxation, pushes the speculum in a contracted canal. So you could understand what the impact would be. But if the provider is a little more patient and tries to get the individual relaxed and explain to them the benefit of relaxing, how to relax, and get them involved in a number of maneuvers that will distract them and allow them to relax and for the speculum to go in, then that discomfort is minimized. Um, Whenever they make complaints of that nature, I mean, I ask the nurse to send them to our colposcopy clinic where we are a little more skilled in dealing with those individuals. Then we do the test for them, and after they have been through that second experience and they understand how to minimize that discomfort, they are able to follow up and get the other pap smears done at the normal health centers.
Okay. So the other thing is this program was introduced in 2024. So
Yeah.
our protocol before generally was that people would go in on an annual basis. So every year you'd go to get your
Well,
screening.
by
So
then it had already changed to every 3 years. But
I think on the ground people tend to still
yes,
have that.
yes,
Well, the
yes.
protocol might have changed, but the
But
information on the ground is
yes,
that
on the ground, had remained the same.
yes.
Yeah.
So for the people who had not been screened, who had been screened, say in 2023, in as much as you said if you had a
Okay,
um,
those who were screened in
low,
2023,
would have
those
to
who were screened in 2023 were screened, and I'd say in the public service, they were screened on the pap smear system, the
perhaps
old system.
right.
Those individuals, if their results were normal, they have to be screened again this year.
Okay.
Those who were screened, who have been screened with the new method, if the HPV result is negative, then the next screening would be in the next 5 years.
Okay. So what I was really trying to get at is that the people who were screened under the pap smear or the old system, they don't wait 5 years.
No, they should come in to get the HPV test done. And instead of saying my pap smear is normal, people need to start saying my HPV is negative.
Okay.
So when you ask for results, what were the results of your pap screening, of your cervical cancer screening? If they say HPV negative, then it sends one information.
Okay.
If they say HPV is positive, then it gives another information. Now, there's a group that we still do the the cytology first in individuals who are between the age of 21, because our screening program starts at age 21. Between age 21 and up to the end of your 24th birthday, we do not do HPV from onset.
Okay.
We check to see whether they are abnormal cells. If they are abnormal cells and it is low grade abnormality, we still do not check for HPV. What we do, we repeat the test the following year. On the other hand, if it shows a high grade abnormality, then we check to see which HPV they have. And the reason for that is in the younger individuals, their body is more efficient in clearing that virus. And the virus is very widespread also in that young population because of their sexual behavior. They change partners frequently. Some of them are involved in more than one partner at the same time. A number of behaviors that places them at a very high risk. But since their body is able to clear that virus efficiently, more efficiently than the older ones, then we do not worry to determine which HPV they have as long as it is a low grade abnormality.
Okay.
And if it is a high grade abnormality, we test for HPV and our monitoring would depend on what is happening. If the HPV is positive, because you can have abnormal cells and your HPV is negative, and that is means one of two things. Either one, the HPV that is causing your abnormality is of a low grade, of sorry, is of a low risk, so it falls into the low risk category, or it could mean that you were in contact with a high risk HPV, but your body has now cleared the virus. So it is now showing HPV negative. And when your HPV shows negative, it means that your body has cleared that virus and will be able to repair the abnormal cells that was caused by the virus. So that is why we do HPV for them when we get those high grade abnormality in individuals between the age of 21 and 24.
Okay. Is there any part, what's the reasoning behind starting screening at age 21 and not on anyone who has been sexually active?
Okay. For the very same reason that I explained, um, the virus that causes the the HPV that causes the largest number of cancers are 16 and 18, and those viruses, they act very slow. They act very slow. So individuals who have had early encounter with those viruses, it would take quite some time before the abnormality develops, because abnormality we're looking for. The abnormality develops, and the other thing is that the immune system is robust enough to clear that virus. at that stage. As you start crossing beyond, and usually it's around the when you're around 30 years or so that you start seeing people suffering from those severe abnormalities that can progress or borderline into cancers. So cervical cancer is very rare in young individuals, except if they are immunocompromised. Individuals who are immunocompromised, we manage them completely different.
Okay. Is there
So
any? Okay. Go ahead.
so if if you have an HIV positive um, woman at a tender age, we will start screening her from then. People with who are on cytostatic drugs, any weakness, any individual with a weakened immune system, we start screening them irrespective of the age.
Okay. Does that also extend to perhaps people who have been sexually abused from a very young age?
Um, Sex, as I said, if they are immunocompromised, they have a
Only.
medical condition that affects the immune system, then we start screening them early. On the
Okay.
other hand, I mean, if they are being sexually abused, all we do is do the routine examinations, annual examinations to see if there's anything and for us to handle it. On the other hand, when we're speaking of screening, screening is one thing, but people who have problems like discharges with foul odor, who start bleeding when they have sexual intercourse, they do not fall into the category of screening. These
Okay.
individuals have to be managed actively. So if, let's say, you have a 19-year-old who complains of postcoital bleed after she has sex, she bleeds, we have to look for cancer or
Okay.
abnormal cells. That is managing her, not screening. Screening is somebody who has no symptoms, who have nothing at all. You say, let me look to see if in case.
Yes.
But those who come in with the problem, with the foul odor discharge, with bleeding after sex, abdominal pain, and things of this sort, we manage them actively to make sure that nothing escapes us. So the individual who have had sex at a very early stage would come with some symptom early enough for us to, and that has to be part of the education process. So they understand that not because you are 19, if you are 19 and you are having, after you have sex, you see you spotting or bleeding, you need to see the doctor to deal with that and not say, I'm not 21 years yet. No, that's not how it works.
Okay.
The 21 year, we start at 21 years for individuals who have no problem at all.
Okay. Thank you. That's a very welcome clarification there, so that we can better understand what that whole program is about and how to manage our issues in that area as women, young women and older women. So Doc, we spoke quite at length about the program, the UHC screening program. As I'm sure you've noticed, our time is coming to an end. So I would really like you to tell us, is there anything we can look forward to in terms of expansion of the program in the near future?
Um, there are one of the limitations in our UHC program is that after when we're doing the colposcopy, the patients have to pay to get the test, the the biopsy done. We are in discussions with the Ministry of Health to see so that that can be eliminated at the earliest, so that when individuals come and the test has to be done, it does not pose any financial burden on them. Um, we also want that to also include individuals who have to do some sort of surgery to eliminate the abnormal cells. So that is what we are looking at. I mean, that matter has been drawn to the attention of those responsible for making the financial decisions, so that the adjustment can be made at the earliest. Um, we are also entered into discussions to see if we can expand the the range of vaccines to the population, so that individuals can come on their own and ask for the vaccine if they so desire. You know, easier access, and not have to, if they need it, they want it, for them to have to find money out of their pockets because they feel it's the best thing for them to do. We're trying to see if we can get the state to invest more in making the vaccines more accessible. Um, we are also looking at a training program for our healthcare providers, so that our colposcopy clinics and our would be better manned, more individuals involved in the evaluation of those with abnormal findings, and we do expect, at least to have a cadre of 15 or so healthcare providers trained to provide that service, instead of one person having to run from here to there everywhere,
That person being you.
to get that, you know, to make it more accessible to the general population. And in that way, they would not only be doing the procedures, but also be managing the individuals with the abnormal findings. You know, we also looking at making adjustments to our database system to better help us better monitor our results, both as it relates to numbers and compliance. You know, so these are the changes we are looking at in the not too distant future, to make the program more efficient, and to make some of the services more accessible.
That sounds wonderful. And I'm very happy to hear that, because we know that cost tends to be one of the issues that holds people back in terms of getting things done when it has to do with their health. So I am hoping that this one will come on stream
Yeah, it will come on
very,
stream
very
because I'm
quickly.
working with um although part of it does not only depend on you, it depends on the Ministry of Health to make certain financial allocation. But with as long as we keep insisting, I think the the necessary funds will be allocated for the vaccine and for the training. We already have everything else we need for setting up the two additional clinics. They are already in progress. So all we need is boosting our human resource capacity, and accessibility to vaccines. It is our only way forward if we intend making a difference in the lives. And we need to understand that cervical cancer affects young women with little children. Imagine a mother is dying and her child is 7 years. Who takes care of that child? What is going to happen? The financial burden and emotional burden it creates on the family, on the individual. So, because this is a cancer that affects young people in particular, young women in particular, and leave who have to who die when their children are still at a vulnerable stage of the development, we are focusing on elevating the standard, elevating the quality, and elevating accessibility to services.
And that is wonderful. But by increasing accessibility, I also wish to encourage all women out there who have been reluctant, who are making excuses, or who are procrastinating, to please take up the opportunities, take up the make use of the availability and the accessibility of the services. Go to your wellness centers, get screened. When you have issues, go in and let your health provider know that you have issues, because sometimes we have a tendency to hide certain issues because of embarrassment or so on. And as you said, probably fear of knowing that we have a serious condition. Okay.
It is necessary that we also use the social and mass media platforms to keep educating our women and pushing that agenda, reminding them. And if we
Absolutely.
keep reminding and circulating the information and not wait for the month of January on an annual basis to focus on a program of that nature, it has to be highlighted constantly and the information must circulate constantly if we intend um, making causing serious modification in behavior because it's a behavior problem that prevents people from accessing that kind of care, you know.
Absolutely. So thank you, Dr. Lendor. Very, very informative. And I hope that our listeners were able to um, internalize everything, to understand everything that you said. And I would suggest to those of you who are listening, sometimes, we get so much information, it's a lot to digest, to go
Most
back
of the
and
time,
replay, listen to the bits that are relevant to you, so that you know how to proceed, how to inform those around you, how to encourage those around you in terms of getting screened for cervical cancer. So thank you again, Dr. Lendo. Any last words that you would like to share with the public
one,
before we end?
one of the things that I think that needs to be done um, to help educate our population better is that we have um, more programs of that nature, but more interactive, where because I may be providing explanation, but that doesn't mean to say that the individuals are receiving the exact message that I want them to receive. And when you have interactive forums where people ask questions, even though others may find it foolish, but sometimes, there is insight in some of those questions and help better clarify and better understanding what this entails. Because the way we're doing it now is like almost like a bombardment of information. Whereas in an interactive environment, you know, the what is important for the individual is what they focus on and what they ask questions about.
Absolutely. And there are interactive sessions taking place year round, not just Cervical Cancer Awareness Month, particularly by the educators, the nurses as well in the wellness centers, but absolutely I agree that there can be more
Yeah, we
can
need to
be
make it
done,
more
and the
crowded.
reach can be wider. Absolutely. So thanks again, Dr. Lendor. It
Thank you
was
very
nice
much.
having you on the program. We look
Likewise.
forward to having you on the program again.
No problem. As long as you need me, you let me know.
Yes, I will. So have a wonderful day. And thank you to all of our listeners for tuning in to Casualty 911 on 88.5 Super FM. Please join us again next week, Monday, from 10 a.m. to 11 a.m. for another episode of Casualty 911. Bye.